So, you have been cited as having five basic measurements for metabolic health. Could you talk a little bit about what they are?
Sure thing. First one is your waist circumference. So you can actually check this at home. And I advocate that people should be checking this. More predictive of health than your weight or your body mass index is. And so you just take a tape measure just above the level of your belly button. Best to measure it first thing in the morning. And if you were a woman, you want that to be less than 35 inches. If you were a man, you want it to be less than 40 inches. The next measurement is your blood pressure. Again, you get this checked every time you go to the doctor, but you can also check it at most pharmacies and grocery stores these days, or you can get a home blood pressure cuff. And you want your blood pressure to be less than 130/85 without the use of medications. So if you've been diagnosed with high blood pressure, that is already a sign that you are not in good metabolic health. And the final three measures come from some basic blood work. Again, these are things that I think people should be checking on a regular basis. Your fasting blood glucose level, so the amount of sugar that's in your blood when you haven't eaten for about 8 to 12 hours. And you want that number to be less than 100 milligrams per deciliters is the units here in the United States. And again, that needs to be without the use of medication. So if you've been diagnosed with type 2 diabetes and you've been put on medication to lower your blood sugar, another sign that you are not metabolically healthy. And finally, we look at the cholesterol panel. But what I always point out to people is that the one number on the cholesterol panel that most doctors focus on, the LDL cholesterol, so-called bad cholesterol, is not a measure of metabolic health. There are two other numbers that are on that panel. Your HDL cholesterol, the good cholesterol is its nickname. And as the nickname implies, you actually want more of this, which is always confusing to people. Specifically, if you are female, you want it to be over 50 milligrams per deciliter is the units. And if you are male, you want it to be over 40. And finally, we look at the triglycerides, another fatty acid that's measured protein-bound fatty acid that's measured on the blood test, and you want that to be less than 150 milligrams per deciliter. Again, and that less is good. So you look at those five measures. If three or more of those are abnormal, you are officially diagnosed with what we call the metabolic syndrome. It's a medical diagnosis, and it means that you are at very high risk of developing things like diabetes, heart disease, many forms of cancer, Alzheimer's disease. All of these things have been associated with the metabolic syndrome. If you have one or two abnormal, it's a warning sign, because we know that people that have one or two abnormal today are likely to progress to the metabolic syndrome over the next 5 to 10 years. And if all five of those measures are within the healthy range that I outlined, congratulations, you are one of only 12% of adults in the United States that can meet all five measures of metabolic health. So, shocking statistic again, 88% of the adults in the United States do not meet all five measures of optimal metabolic health.
Wow. So, in your book, you list in detail principles on how to have good metabolic health, how to stay off your operating table. So, could you share a little bit about the biggest ones that's listed in your book?
Yeah, so the first one, I put it first because I think it's most important. It's sort of the overarching principle that you want to be viewing your health as a system, not as a goal. And what that means is that you don't want to be necessarily focused on just the short-term goals. Many people say, I want to lose 20 pounds. And when you focus on short-term goals, one of two things tends to happen. Either you meet that goal, you're able to lose the 20 pounds by doing whatever you do, and then you say, great, I did what I wanted to do, and you tend to slide back to your old habits. Or probably more commonly, you don't meet that goal. It's hard to lose 20 pounds, and you're doing this restrictive thing, and so you just give up and you sort of lose hope. And in the end, neither one gets you to a good spot. So instead, what I try and get people to do is focus on their overall health, focus on the system. I want to be metabolically healthy, and I am going to find the habits that promote my metabolic health. It's a more positive way to think. It's a more sustainable way to think. And I find that it leads people to more success. The next principle number 2, is eat whole, real food. And, there's all the debate in all the dietary camps, the vegans and the carnivores, the keto and the Mediterranean diet, the Atkins people, all these things. When you look at what is common among people who are able to get good metabolic health, lose weight, improve, reverse their diabetes, reverse their high blood pressure, things like that, it comes down to eating whole, real food. And I explain that to people. I define it as the things that grow in the ground and the things that eat the things that grow in the ground. So these are your animal products. These are your plant products. I think depending on your preferences and your situation, there is some room for, how much of each you want to incorporate. But ultimately, the more that you eat whole, real food and the less that you eat processed food, the healthier you are going to be.
So when